Welcome to Module 1 of volunteer training for Unity Hospice. In this module, we're going to be covering hospice history, philosophy, and goals. My name is Roman Archer, and I serve as the chaplain and director of patient services at Unity Hospice. I will be walking you through the volunteer training. There is a short little bio of me up on the screen. You can take a few minutes and read that, and then we'll continue on. All right, well, let's jump right in and talk about what is hospice. What is hospice? Hospice is specialized care focused on comfort, dignity, and quality of life for individuals with life-limiting illnesses, usually within a 6-month time frame, when curative treatment is no longer an option. Rather than aiming to cure, hospice manages symptoms and provides emotional and spiritual support to patients and their families. The goal is to create a supportive environment that honors each person's unique journey and fosters meaningful connections during this time, helping patients live as fully and as comfortably as possible. So throughout these training modules, we're going to be working together to explore what this comprehensive care that we're talking about actually entails, and also your role as a volunteer within that care. Hospice promotes inclusiveness in the community by ensuring that all people, regardless of race, ethnicity, color, religion, gender, disability, sexual orientation, age, disease, or any other characteristic that you can think of, we want to make sure that every person in our community has access to dignified end-of-life care. That's what hospice is all about. As we get ready to jump in, we're going to start with a quote. And this quote comes from Dame Cicely Saunders, who you will learn a little bit more about during today's module. Her quote says this: "You matter because you are you, and you matter to the last moment of your life. We will do all we can, not only to help you die peacefully, but also live until you die." Okay, so your volunteer experience begins today. In this module, we're going to be covering a brief history of the hospice movement. We're going to be talking about hospice philosophy and guiding principles. We're going to talk about hospice care and the many services that hospice provides. And we're going to take a glimpse into the critical role of a hospice volunteer. Okay, now throughout this module, there's going to be a few different videos. There are going to be links to these videos. And to access this resource, please use the link that is found in your Module 1 handout. There'll be a link there to this video resource. This video is by Julie McFadden. She is known as the hospice nurse. It's a little bit longer of a video. We encourage you to watch through it all in one sitting, but if you can't, definitely come back to it. She covers a lot of information, and it's a lot of practical information about what hospice is and what happens at end of life. So what we're going to do now is ask you to pause this video, go take a look at that, and when you are done with that video, come on back to our Module 1 training. Okay, throughout this training, you're going to encounter several contemplative journal slides. We encourage you to pause the video or training session when you reach one of these and take time to reflect on what you have learned or any thoughts and feelings that may have arisen in the content that we've covered. Being a good hospice volunteer involves being in touch with all of your own emotions and being able to empathize with others. The last video that you just watched from Julie McFadden had a lot of content, and so there may have been some emotions and some feelings and some thoughts that came up for you. We want to pause and give you an opportunity to work through that. And so our first journal prompt asks this: what brought you to this work, specifically the work within hospice? We recognize that this field is not for everyone. We each have a unique journey that has led us to where we are in this moment. So we want you to take a second and consider what specifically drew you to hospice work. How would you explain your personal journey to someone who asks why you decided to volunteer your time? Please pause the video now, Reflect on this question, and when you are ready, we will continue together. Okay. The first section, we're going to dive in and we're going to talk about a brief history of the hospice movement and how we got to where we are today. Now, you cannot talk about the origins of the hospice movement without recognizing Dame Cicely Saunders. She lived from June 22nd, 1918, and passed away July 14th, 2005. Now, the term hospice originates from the same linguistic root as the word hospitality, and it dates back to medieval times when it referred to a place of rest for the weary or ill travelers. Okay, so it's kind of a cool concept when you think about the word hospice and where it derived from being a place of rest for weary travelers. Now, hospice was the entire concept was defined by Dame Cicely Saunders, who in 1948, she began her pioneering work with the terminally ill. And what she was doing at the time challenged the notion that death was a failure of medicine. So in that time, people were poked and prodded, and every nature of medical intervention was tried in efforts to save the patient from death. As you can imagine, though, that would leave many people right up until the moment of their passing in some pretty uncomfortable and maybe even some undignified scenarios. And so Dame Cicely Saunders wanted to revolutionize the way we treated those who were terminally ill. And she founded St. Christopher's Hospice in London in 1967. And it revolutionized end-of-life care by emphasizing pain management, emotional support, and dignity for the dying. Okay, 3 things: pain management, emotional support, and dignity for the dying. That's what she was all about. And her vision for what hospice is and could be continues to influence modern healthcare worldwide. Another hero in the hospice world and space that you want to know about is Elizabeth Kubler-Ross, born July 8th, 1926. She passed away in August of 2004. In 1969, Elizabeth Kubler-Ross wrote the book On Death and Dying. It's based on her conversations with terminally ill patients, and in it, she identified 5 emotional stages often experienced when facing death. So when someone has a terminal illness diagnosis, from her interview, she found that in general, they move through 5 stages, starting with denial, then anger, then bargaining, depression, and then acceptance. Okay, so these stages were originally specific to those diagnosed with terminal illness, but many people also know them as like stages of grief. It is important just to notate, though, that Kubler-Ross work focused again on those that had the diagnosis of a terminal illness. And there's much more recent and comprehensive research on grief that has expanded our understanding of grief's complexity beyond just these 5 stages. However, her book On Death and Dying was seminal work within the hospice space and really influenced how people interacted with the terminally ill. So in summary, both Saunders and Kubler-Ross have left indelible marks on the field of end-of-life care. And as you volunteer your time and energy in this space, you will undoubtedly be influenced by their contributions to the hospice movement. Okay, we've got another journaling exercise here. The purpose of this journaling exercise is to delve into the different emotions and explore how we feel as we've talked about a few aspects of hospice care. Some of them may be challenging, and so again, we want you to pause, sit with your emotions and your feelings, even if they're uncomfortable. It's a normal part of the process. Acknowledge the feelings and learn from what they have to take us or to teach us. So there's a few questions up on the screen specific to those 5 stages that we just talked about by Elizabeth Kubler-Ross. And so we want you to go ahead and pause the video, take your time, and when you're done reflecting and journaling on these questions, come on back and we'll begin. Okay, hospice in the United States. The first hospice, which we talked about, was founded in St. Christopher's Hospice in London, England. It was opened in 1967. Now, the first hospice in the United States was opened in 1974 in the state of Connecticut. Okay, in the year 2020, an estimated 1.7 million patients received services from hospice in the United States. That's the last time that we have updated information, and that comes from the National Hospice and Palliative Care Organization. They put out annual facts and figures. If you do a quick Google search, you can find that information. There is very comprehensive information about the hospice movement within the United States. But in 2020, there were an estimated 5,050 roughly hospice programs that were operating nationally. Now, since the establishment of St. Christopher's Hospice in 1967, the hospice movement has continued to grow and evolve not only in the United States, but worldwide. These hospice programs vary widely in terms of their scope, their services, and their settings, which is a good thing. It caters to the diverse needs of patients and their families. And so with an increasing recognition of the importance of holistic and compassionate end-of-life care, the hospice movement continues to play a vital role in supporting individuals and their loved ones during their final journey. Hospice as a Medicare benefit. This is an instrumental moment in the advancement of hospice care within the United States that is important for us to just notate and to be aware of. It was marked by the establishment of what's called the Hospice Medicare benefit. In 1979, the Healthcare Financing Administration initiated 26 demonstration projects across 16 states. What they did with that research, they advocated, and it was led by the National Hospice and Palliative Care Organization. They advocated and got this research done, and their efforts culminated in the enactment of the Medicare benefit that came to be in 1982. Okay. And it is significant for several reasons. Number one, it expanded access to care, provided coverage for hospice services to terminally ill patients under Medicare. And this ensured that end-of-life care was accessible to a much larger segment of the population. This benefit, it covers medical and support services, and it makes it financially feasible for patients to receive comprehensive end-of-life care. It also set a standard of hospice care. The benefit established criteria for hospice care providers, helped standardize the quality and scope of the services that were going to be offered under hospice programs. This is important because it ensures that patients, their families, they're receiving consistent, high-quality care across the different hospice programs. So as I mentioned, hospice takes place in many settings, looks different according to the program, but there are some standardized protocols that are followed just to make sure that the type of care is, very high care. It also does put the emphasis on care. By covering hospice services, Medicare shifted the focus towards care and emphasizing what's really important at end of life, which is the comfort and quality of life, rather than just the curative treatments. This was a significant shift in the healthcare approach as well. And it set the stage for growth of hospice programs. The establishment of the benefit spurred the growth of other hospice programs across the United States, made it possible and more accessible for people. It gave a financial foundation that allowed more organizations to develop and expand their own services. It set up a holistic care model. The benefit recognized the importance of holistic care, covering not just medical needs, but also the emotional and the spiritual support that comes alongside of that. There's a lot of pain at end of life. That's not just physical pain. There's emotional and spiritual and relational. And so it provided a holistic method of care. It expanded to support for families. It includes support for not just the terminally ill, but their loved ones as well. The Hospice Medicare benefit acknowledged the critical role that families play at end of life. and wanted to alleviate the burden that they carry during these challenging times. And so, as you can see, the hospice Medicare benefit was a transformative policy. It greatly improved accessibility, quality, and scope of end-of-life care in the United States. It ensured that patients could receive compassionate and comprehensive care focused on comfort and dignity in the individual's final days. Okay, let's talk about something called length of stay and why it matters. Throughout these modules, you'll be introduced to some terms, some lingo, some language that is specific to the medical field, but in this context, more specifically, hospice. In hospice, length of stay is a critical concept that is often referenced, and it simply refers to the duration between admission to hospice care and then the time of either discharge or the time of passing, okay? So a little statistic again from the National Hospice Palliative Care Organization. In 2020, they reported a median length of stay, or abbreviated LOS, of 18 days. Okay, so what that means is this signifies that half of the patients entering hospice care during that period received treatment for fewer than 18 days. The other half received care for more than 18 days. And that's how we get the median length of stay. Now, we want to see that number increase. We want to see the length of stay go up for many reasons. Prolonging the length of stay in hospice care carries many advantages to patients, to their families, to their loved ones. Mainly, it facilitates the development and implementation of comprehensive tailored care plans. Now, we'll talk about care plans in more depth, but basically, that's just the plan of care. At the end of life, what is the clinical team going to provide for interventions? We call that their care plan. And the more time we have with a patient and with their loved one, the better their overall quality of life is going to be. Okay, longer hospice stays offer extended emotional and spiritual and pain comfort for patients and their families. And ultimately, that's going to reduce stress level. We want the end of life to be as comfortable as possible. And the earlier someone can get on hospice and more extended that hospice care can be, it's going to be more comfortable for them. We have more time to build relationships. As you can imagine, end of life moves quick. In 18 days, for someone to meet a clinical team, whether it be the chaplain, the social worker, the hospice nurses, whatever that looks like, for a family and someone that is diagnosed with a terminal illness, to meet that care team and to wrap everything up within 18 days is not ideal. We want to see that length of stay go up. It can also be cost effective for the family as well. When they come on hospice, it can save on a lot of the curative treatments that they may be going through, hospital stays, those sort of things. And so there's a lot of benefits to seeing that length of stay go up. We believe that hospice gives a holistic and an effective care approach. And understanding these benefits really underscores the importance of educating the public about hospice care and its advantages. The knowledge of what hospice can give empowers individuals to maximize the benefits of hospice when the need arises. And so length of stay, it's an important principle, something that you may hear a lot, but we would love to see more people coming on hospice earlier. A lot of people wait until, again, they're really close to passing away. There's a lot of advantages that are given to coming on hospice a lot earlier than that. So length of stay is an important thing to remember. Okay, hospice philosophy and guiding principles. We're going to take the next few minutes together and talk about what it is that guides hospice care. What are the values? What are the principles? It is a profound time in someone's life when they are nearing the end of life. And so as caregivers, understanding and embodying these principles is essential as we strive to meet the holistic needs of those that are under our care on hospice. So the first guiding principle within hospice is that we regard dying as a natural part of life. In our society, discussions about death often evoke discomfort and unease. However, as caregivers in the field of hospice, it is imperative that we confront this reality with honesty, empathy, and acceptance. Dying is not a failure of medicine. It's a natural stage of the human experience that we all face. I often say that it's only a matter of years before I'm on the other end of receiving care. We're all going to experience death. It's not a failure of medicine. It's a natural occurrence. It's a natural stage in the human experience. And so by embracing this truth, we can empower patients and families to navigate this journey with dignity and grace. By seeing death as part of life, we shift from cure to care, create space for meaningful connections and closure. The sooner, it doesn't matter how young you are, how healthy you are, but the sooner we begin to think about our own death, our own passing, the more we can prepare not only ourselves, but our loved ones and those that we care about, and make sure that they are well taken care of. And so in hospice, we regard dying as a natural part of life, and that informs a lot of the decisions that we end up making. We'll talk more about that in this and in other modules. The second guiding principle is this, is we believe that people have the right to die pain-free. So we know that dying, it's a natural part of life. And with that, we believe that every person has the right to die pain-free. In the final stages of life, relieving pain becomes not just a medical obligation, but a moral obligation. It's a fundamental right that we as caregivers are committed to upholding. We see it all the time, but pain strips individuals of dignity, of peace, and of comfort. And by providing effective pain management, we honor their humanity and their inherent worth. So in hospice care, pain extends beyond just the physical, although that's normally what we think of, right? When we think of pain, we're often thinking of physical pain. But pain extends beyond just that. It includes emotional, social, spiritual, relational suffering. It can come in all sorts of forms. And we deal with all of it at end of life. And so our role is to offer holistic support, addressing all aspects of pain. We do that through medication, through therapies, and through compassionate presence. All right, the third principle is that we believe that people who are ill and their families have the right to determine their own end-of-life experience. So as you can see, we're kind of building the path forward here. We know that dying is a natural part of life. Everyone's going to experience it. Because of that, we believe that people have the right to die pain-free. We also believe that they have the right to determine their own end-of-life experience. And this really informs how we facilitate care within hospice. In hospice care, we recognize that each individual's journey, it's unique, it's shaped by their personal beliefs, their cultural traditions, their personal experiences, and their own family dynamics. And so empowerment is key in hospice care. Our role is to listen without judgment and support informed decisions. We want them to have all of the information out on the table. And then we listen without judgment as they make decisions regarding what they want their end of life to look like. Whether it's choosing treatment or planning end of life rituals, we honor their choices. We check all of our expectations, what we think it should look like and how it should happen at the door. And by being a champion of their autonomy, we can affirm our own commitment to compassionate, person-centered care, ensuring the voices of those we serve are always heard the loudest. Okay, another principle within hospice care is that we believe in a holistic approach to that care. Health is more than just the absence of disease. It includes the physical, emotional, mental, social, relational, spiritual elements and dimensions of a person's well-being. And so in hospice care, we want to honor the whole person, the holistic view, not just their illness. We believe that people are more than a failing body. They are a blend of hopes and fears and emotions. There's so many things that make up the human experience. And so we attend to physical needs with expert care, but we provide emotional support for grief and fear. We want to create soothing environments. We offer spiritual guidance through chaplaincy and any sacred rituals that may bring comfort. We want to nurture mental well-being by engaging in meaningful conversations. We call this life review or compassionate inquiry. We want to support their cognitive needs through companionship. Socially, we help patients connect with loved ones. We want to foster closure and companionship for the patient and their family and friends. See, this holistic approach ensures that we honor the whole and the full human experience, not just their physical body, but everything it is that makes them who they are. We embrace mind, body, spirit in our compassionate end of life care. And in order to do that, another principle is that we believe that true holistic care is best delivered by a team of specialists working in concert together. And this is one of the things that I love most about hospice care. It's a very unique form of care. And this is one of the things that makes it unique is we believe that holistic care is delivered best by a team of specialists. And we call this team that works together within hospice the interdisciplinary team. And so during your volunteering time, you're going to interact and interface with different members of that interdisciplinary team. This team includes professionals like physicians, nurses, social workers, chaplains, counselors, and volunteers, other volunteers as well. Each person offering their expertise to provide that holistic care. So again, it's not just about the physical. So certainly doctors and nurses can attend to that. That's what they're best trained to do. But then we've got social workers and chaplains, and each one is working in concert with the other. And when that happens, we're able to deliver compassionate care to the whole being. This collaborative model really ensures that the diverse needs of any individual at the end of life are fully supported. I want to take a second and just to define what the interdisciplinary team looks like in their approach to care. This team approach goes beyond the mere presence of various disciplines. It really is about the integration of their expertise, the perspectives, and the efforts toward a shared goal. This approach, it's going to foster a sense of synergy where each team member contributes their unique insights and skills, and really ensures that there's a comprehensive care plan that's in place. At the center of that care plan is going to be the patient and their family. They're the ones that's really driving the care plan. But we want to make sure that they're doing that with an informed mindset. And so each one of these expertise steps in and makes sure that the patient and their family is fully informed. So collaboration is at the heart of this interdisciplinary model. The team members are regularly meeting. They're regularly in open communication, and they're shared decision making. They work to make sure that every aspect of care, medical, psychosocial, spiritual, emotional, it's all addressed and done so with the utmost sensitivity, again, to the individual's preference and values. Ultimately, the interdisciplinary approach epitomizes the essence of hospice care, a collaborative, patient-centered approach that seeks to uphold dignity, comfort, and quality of life. So the interdisciplinary team is pretty unique. And we want to talk for just a second on what the interdisciplinary team is made up of. What are the disciplines on that team? So the interdisciplinary team, you may at times hear it abbreviated as IDT, again, interdisciplinary team. But in hospice care, it's a group of healthcare professionals and trained volunteers. You're a part of this team as well, who collaborate to provide comprehensive holistic care. You're going to see up on the screen, there's a little visual of what that looks like. You're going to notice again that the patient and their family is in the center. They are central to this care. And then each member of the team brings their unique expertise. There's physicians, there's nurses, social workers, chaplains, spiritual counselors, volunteers, bereavement counselors. But again, the important thing to remember is at the center of this, it's all about the patient and their family. And also to remember that you as a volunteer play an integral role on this team as well. Okay, we've got another video resource here. We're going to take a second and pause this video. I want you to watch a personal story that highlights the profound impact that hospice care can have. They're going to interview Rudy, who is a hospice patient, and some of his family and friends, talk about his experience within hospice. And it's really going to put a face and make a lot of what we've been talking about so far a little bit personal. When it's more personal, it's more impactful. And so I want you to maybe imagine that Rudy is someone that you know, someone that you love. If it's personal, it's impactful. So throughout this module and the modules to come, you're going to hear some personal stories of people that have been on hospice and the impact that it has had on them and their loved ones. To access this video, please use the link provided in your Module 1 handout. Okay, something really important that we need to talk about, you're going to hear a lot about it, and you're going to even contribute to it yourself, is something called a plan of care or a care plan. A plan of care in hospice is a personalized and comprehensive guide. It's created by the interdisciplinary team to meet the unique needs and goals of the patient and their family. So there is no one-size-fits-all approach when it comes to hospice care. Each person is unique, their end-of-life journey is unique, therefore their care plan is unique as well. Their care plan is developed collaboratively with the input from the patient and their family and various healthcare professionals, all working together to make sure that the patient's well-being is addressed. It's the first and foremost importance. The plan outlines clear goals, specific interventions designed to enhance the patient's quality of life and provide comfort. The plan of care promotes seamless communication and coordination among team members. It is regularly reviewed and updated to adapt any changes in the patient's conditions or wishes. End of life moves fast, so things are always changing. And so we see the care plan really as a living, breathing document. It's constantly being updated, notes are being left, and adjustments are being made, really just to make sure that the quality of life for the patient and their family is first and foremost. So in essence, the plan of care serves as the foundation of hospice care. It guides all the care that is given by physicians, chaplains, social workers, nurses, volunteers. It's our guiding document, and it delivers compassionate, patient-centered care. Again, the goal is dignified, end-of-life care. And so the care plan is the document that outlines that. So let's talk about the plan of care and the team assessment. Again, that plan of care or the care plan, we see it as a living document that's guiding the scope of our care and how we're providing it. It's important to remember that this is done through team assessment. It's an ongoing process, and the assessment belongs to all members of the team, including the volunteer. So for all or any of you that are having direct patient care interactions, you're going to be asked to make assessments, and you do that in the form of what we would call like a visit report. So after you visit with a patient that you're assigned to, you're going to be leaving some visit notes. And this information provides an initial understanding of the patient's needs and preferences in that moment. But it's so important to understand, and you're going to hear us say it a lot, that end of life moves very, very fast. What was true for a patient and their family yesterday may not be true today. Something that they expressed previously may not be true today. And so when you are interacting with a patient and with their families, we're asking that coming out of that visit, and we all do this, every member of the interdisciplinary team, we leave a note with our observations, our assessments of their pain levels, anything that we've noticed, any changing preferences, so that we can all be on the same page. And so it is a team goal. All of us contribute to that plan of care. And your role in this process is critical. What has the patient communicated to you? You'll make a note of that. Is there any changes that you've noticed, or anything you've noticed in their condition? These insights are vital for the team to continually reassess and update that plan of care. Again, the care that's delivered at end of life, it's a dynamic process. It changes from moment to moment. And to help us adapt to that is we're all constantly contributing to the plan of care together. Okay, so the team assessments and holistic care. We just want to give you some examples of exactly what this looks like. Each discipline is going to approach the assessment or their scope of expertise a little bit differently. We're all going to come identify problems of pain with a broader view of how it may simultaneously affect other experiences the patient and the family they're going to have. Okay, so their functional abilities, their interpersonal relationships, sense of well-being, sense of spirituality. In hospice care, decisions regarding pain management, emotional support, medical procedures, spiritual considerations are interconnected. It's this idea of holistic care again. Balancing these aspects effectively ensures that care respects the patient's beliefs and enhances their overall well-being. So some specific examples of what we're talking about. Every discipline has to take into consideration other disciplines on the interdisciplinary team and how that may affect the lived experience of the patient and their families. For instance, on the physical side of things, pain management is a really important factor. But at the same time, balancing pain medication so that we're both managing physical discomfort without compromising social interaction is crucial in hospice care. And this is where the patient really comes into play as well. We want them to develop their plan of care in concert with the interdisciplinary team. So what's important to them? Pain management may be the most important thing, but for other people, pain management isn't as important as maximizing the amount of time that they have left with their loved ones. And so to whatever degree pain management may get in the way of that, we're going to have some conversations there. There's this interconnectedness when it comes to the holistic approach of care. Another example may be addressing emotional distress effectively can reduce at least the perception of physical pain and improve the patient's overall well-being. Another thing that we encounter often is respecting a patient's spiritual beliefs when planning medical procedures. We want to make sure that any sort of medical intervention aligns with their religious beliefs. Some people have religious objections to certain types of care, and we want to make sure that we're taking that into consideration as well. Creating supporting environments for family visits can enhance emotional connection and social support at the end of life. We want to create environments for closure, for reconciliation. So these are just a few examples that show you that interplay of the different aspects of someone's life. It's why the interdisciplinary team is so important. It's why the plan of care and constant assessment is so important, why everyone contributing together, meeting regularly, being in regular communication together in such a fast-paced scenario is so important, is we want to make sure that holistic care is being put out in front and everything is being balanced through that. So these examples demonstrate how decisions and interventions in hospice care impact multiple dimensions of a patient's life, and it emphasizes the importance of holistic and integrated approaches to care. Okay, we've got another journaling exercise here, and throughout this training, you're going to encounter several contemplation journal slides like we've talked about. Each time we want to encourage you to pause the video, and when you reach one of these, take the time to reflect on the questions, what it is you've learned, any feelings that arise. Again, being a good hospice volunteer, working in the hospice field, it is crucial that we're in touch with our own emotions so that we're able to provide healthy and adequate care for someone else. And so this journal prompt, it gives a scenario, and this is the scenario. Okay, we've talked about plan of care and assessments and a holistic approach with the interdisciplinary team. And so this is the scenario. After visiting a patient who is experiencing significant pain and discomfort, you are required to write an assessment or a visit note to document your observations on the patient's condition and any interventions or changes in their care plan. So, describe your approach to writing an assessment after a patient visit. What key details do you focus on? What would you include and why? How do you balance being thorough in your documentation while also ensuring it is concise and clear for other team members to understand? How do you handle any emotional reactions you might have while documenting challenging situations, such as witnessing a patient's pain or distress, or even the passing of a hospice patient? Consider the ethical responsibilities involved in writing accurate and detailed assessments. How do you ensure that your documentation upholds these ethical standards? Your visit notes and your assessments will be included in their medical documentation. And so there are ethical responsibilities with that. So we want you to pause the video now, take a few minutes. This one's maybe a little bit longer. Reflect on this question. And when you're ready, we will continue. We'll actually look at an example together. All right, up on the screen now, you're going to see an example of an assessment or a visit note. This is something that would be added to a patient's medical record, and it's essentially just an assessment left by potentially a volunteer after a visit was completed with someone. Take a second and read it. It's a good example of what that can look like, but want to give just a few pointers on some of the observations that we make and why this is a good visit note. First thing is the length. You want to make sure that you keep these short and concise. You don't want to get bogged down with too much information. Remember, this is going to be a permanent addition to someone's medical record. It is going to be reviewed by other members of the interdisciplinary team. They're going to look to see if there's been any changes, any updates, how the patient is progressing. Oftentimes they'll review this before their next visit. So you want it to be clear and concise. You want to make sure that the important aspects of your report, the way you structure it, has clear headings, any actions taken, outcomes, that sort of thing. You're going to notice that there is a pain scale on there. That is something that is always helpful. Whenever you're visiting someone, if you can get them to give you a verbal pain rating, a simple 1 out of 10 will do. Other times, they're going to be unable to give you any sort of verbal pain rating. Maybe they're nonverbal. They're at the stage of their journey where they're no longer to communicate. In those sort of cases, we're looking for nonverbal signs of pain. So you'll notice they got a pain rating 10 out of 10, so that must have been verbally. But they also noticed there was restlessness in bed. There was discomfort with furrowed brows and occasional groans. Those are all wonderful signs and observations to look for. They give us an idea if someone's uncomfortable or in pain. So they saw an obstacle, something that was wrong, and then they worked for an intervention, and they listed what that intervention was. In this case, they coordinated with the appropriate care member to give more pain medication. They also did another intervention, which was simply adjusting pillows and helping to reposition Mr. Jones for comfort. And then details what the visit consisted of, being that they engaged in comforting conversation. They offered to read aloud, but he preferred the conversation. So they did what we call life review, where they talked about family and memories, very common at end of life. They gave an update that the pain medicine did have an effect, brought the pain level down from a 7 out of 10, which is great. He was a little bit more relaxed. Then you'll notice that at the very end, they also just kind of left a follow-up that continued focus on pain management and emotional well-being is crucial. So the structure of it, the length of it, the detail of it, this is a really good example of what a visit note can look like. The medium on which these are done vary. Currently, we use an online platform where all visit notes are recorded. Sometimes maybe a paper copy would be most appropriate. So the medium is not as important as the actual information and format in which you do it. But this is a great example of what a visit note / assessment would look like. 2 other quick notes that we'll mention is documenting such visits can be emotionally challenging. So we always recommend that you take a moment to process your feelings before documenting. It's going to help maintain objectivity and professionalism in the visit note that you do leave. So give your space for yourself. Be kind to yourself. Make sure that you give opportunity to process before you leave your visit note. And then just always remember that this is a permanent addition to their medical record. So you want to make sure you have a commitment to accurate and honest reporting, high standards when it comes to documenting in their report. It just enhances integrity and effectiveness of the hospice team. Moving on from the assessments and visit notes, where does hospice happen? As mentioned earlier, hospice care, it's not a place where people go to die, but rather it's a specialized plan of care, and it's tailored to individual needs. So it's the approach to care. It's more about how care is done than where care is done. But with that being said, there are some places where hospice tends to take place. The majority of hospice care is provided in the place that patients call home. So for many people, this is their home. Most people, a high percentage of people, prefer to die in their home. When surveyed, that is the most common response. Sadly, not nearly enough people have the opportunity to do that with complications at end of life, or just simply their home not being conducive to that process taking place. So many people have to go to assisted living facilities, skilled care nursing facilities, local hospitals, hospice houses. Again, where hospice is provided is not nearly as important as how hospice is provided. It is a plan of care. It is a way of meeting people at end of life. The thing that makes Unity Hospice most unique is, as far as we know, we were the first hospice in all of New England to offer dedicated hospice care to a population within assisted living facilities. A lot of hospice care agencies do come into assisted living facilities or hospice houses or local hospitals, but we started with our primary population being to care strictly for those that were residents at Harmony Homes by the Bay. As we grow, we will see that expand as we seek to just impact as many people as we can at end of life. But that is something that makes us a little bit unique, is for the most part, our hospice care is provided within the controlled environment of Harmony Homes by the Bay. What does hospice provide? What does hospice provide? Just a quick list here. We'll just kind of go through them quickly. Pain and symptom management. Obviously, physical is the first thing that we think of, but that's also emotional, spiritual, relational. They have chaplains and social workers that are available to the patient and their family. There's counseling and emotional support, spiritual care and connections, respite care. So if there's a family and maybe care is being delivered at home, under hospice, if they need a little break to get some errands done, to get out and do some grocery shopping, or even a night away for their own mental health, hospice care can provide respite care. Provides bereavement care for up to 13 months after the passing of a loved one. There is bereavement care, constant check-ins and resources that are available to the bereaved loved one to help process their grief. Assistance and resources for caregiving. Medications can be covered by hospice, and then certain medical supplies and assistive equipment as well is all provided under hospice. All right, let's talk about when the right time to call hospice is. And there's quite a bit of information that we want to unpack with this idea. If you'll recall, we talked about length of stay earlier in this module, and length of stay just referred to the period of time from when someone is admitted to hospice, so their admission date, to the time of their passing. In 2020, the length of stay, the median length of stay was 18 days. And as we mentioned at the time, we want to see that number go up. One of the ways that we see length of stay go up is through early intervention. Now, that is difficult because for many people, they delay calling hospice or even getting information on hospice because when they think of hospice, they think of giving up. They think their loved one is giving up. They think they're going to be possibly leaving time on the table, that they could have more time with their family, but by going on hospice, it's going to hasten their death. None of those things are true. Early intervention in hospice simply means that they're going to have access to the resources that are available to them as part of the hospice program. So they're going to have a dedicated care team that can care for them and their family. It's about quality of life. Now, hospice care is typically considered when a patient's medical condition is terminal with a life expectancy of 6 months or less. So some people have a prognosis of 6 months or less, and they will decide to continue to do every sort of curative treatment that they can. even at the expense of their quality of life. So they want to fight it as long as they can. For instance, in the case of a cancer or something like that, radiation treatment. However, that comes with a lot of side effects. So for some people, they're going to get to a point where they're going to say, you know what, we're going to look at more of comfort and quality of life rather than the curative treatments. It's also appropriate when managing symptoms becomes a priority and caregiving needs increase. They may decide to transition from aggressive treatments to supportive care. Again, hospice gives a dedicated care team that's going to come up with a care plan based on that individual's desires and their personal preferences. So it's not giving up. It's simply a different way of making sure that the quality of life for whatever amount of time they have left is there. Now, who can give the referral? Anyone can refer someone to hospice. It does not mean that they're going to be coming on hospice then. It does not mean that hospice care will begin because they've gotten a referral. You as a volunteer, maybe you have a loved one, a family, or a friend that is terminally ill. You could refer them and say, hey, you should call a hospice agency. What's going to happen is a hospice nurse is going to come out, give them an assessment, give them all sorts of information on that. But the admission to hospice is going to be up to them. They might not feel it's the right time personally, or a physician may decide that they're not quite ready. They don't meet the criteria for hospice yet either. The important thing is that we want early intervention so that people have the information and they know what benefits they have access to, and they have information on when they can enact those benefits as well. I do also want to just say that the life expectancy of 6 months or less, not everyone falls into that box. So that's what the prognosis has to be. But certainly if after 6 months they have not passed away, what happens is the benefit period can get extended. It starts with a 90-day period, and then indefinitely after that, for every 60 days, it can be reenacted for really indefinitely, as long as they have the criteria of a 6 month or less prognosis. They can keep being recertified into hospice, and that is not uncommon. Every disease takes a different course, and so some people are going to be alive a lot longer than what the prognosis is, and they can stay on hospice for the duration of that time as long as they are still meeting the criteria of having a terminal illness. There are times where someone goes into remission. They're on hospice, and so they'll get discharged, and we celebrate that. They're discharged from hospice because they no longer meet the criteria of 6 months or less. So just keep that in mind. But when is the right time to call hospice? The sooner, the better. We want people to be well informed. Okay, who pays for hospice? In generalities, hospice benefits. We talked about the Medicare Benefit Act. So Medicare Part A, Medicaid, commercial insurance plans have a hospice benefit. There is self-pay. Some hospice services may be billed to the patient family according to their own ability to pay and individual hospice policies. And then there are some programs that just run on charitable contributions, and grants may be used to assist as well. Essentially, hospice is available for anyone. We want to make sure that everyone at end of life has access to dignified care at end of life. All right, we're going to take a moment and watch a brief video. It recaps some of the nuts and bolts of hospice care, essentially the Medicare covered hospice, and overview of the basics. So this is just a short video, but does go over some of the nuts and bolts and recaps some of what we just talked about in hospice care. So to access this resource, please use the link found in your Module 1 handout. Okay, as we get ready to wrap up Module 1, we're going to talk about some practical things on essentially what does a volunteer hospice do. Now, if you've reached this point in your hospice volunteer journey, you likely have an idea of how you'd like to volunteer. You've probably had some conversations, you've thought about it a little bit, but let's explore some opportunities to see if there are any areas that you haven't considered or were aware of. So the first category of volunteer care is what we call direct patient care volunteers. And this is one of the main types where you interact directly with patients and their families. And this can involve various activities that include companionship, spending time with patients, engaging in conversations, listening to their stories, providing emotional support and company, so companionship. Music, maybe playing instruments, singing, bringing recorded music to comfort and entertain the patient. Really just enhance their mood, providing a sense of normalcy and joy. There's art therapy, guiding patients in creative activities such as painting, drawing, or crafting, which could be therapeutic and a means of self-expression. There's pet therapy, bringing a trained pet to visit patients. Can provide comfort. There's been studies that show it reduces stress, improves overall emotional well-being through interaction with animals. Housekeeping, simply helping with light cleaning tasks, maintain a clean, comfortable environment for the patient. So it's basically just tidying up, dusting, doing laundry, little things like that. Reiki and massage, gentle touch therapies like Reiki or massage help relieve pain, reduce stress, promote relaxation. Shopping and errands is another one, maybe going for a walk, life review, aromatherapy. There are so many activities, not only provide comfort and support, but also just enrich their lives. Again, it's quality of life at end of life that we're concerned with. So that is what direct patient care looks like. It is, again, important just to notate that you'll never be asked to provide like any sort of medical care or anything like that. You leave that to the team of trained professionals. But if you are a direct patient care volunteer, that does reference exactly what it sounds. You are interfacing directly with a patient. So that's the main category of volunteering is direct patient care volunteers. And the second one is what we would call indirect patient care volunteers, okay? Indirect patient care and hospice volunteer involves supporting the hospice organization in its operation without directly interacting with patients. These roles are crucial for maintaining the hospice's functionality and ensures that direct patient care can be provided effectively. And so this is administrative support, maybe office tasks such as filing, data entry, answering phones, preparing mailings, anything that helps run the hospice run smoothly. Fundraising, participating in organizing fundraising events. Community outreach, raising awareness about hospice by educating the community, or marketing and outreach in recruiting more volunteers to the program as well. Event planning, bereavement support, which is following up through calls or mails to bereaved families, different creative projects, making cards, creating memory books, things of that sort. These roles are essential for the overall operation of the hospice organization. Again, helps ensure that it is running smoothly and receiving the highest quality care for our patients. So again, the two categories there are direct patient care or indirect patient care, and there's lots to do below both of those categories. Okay, we've got one last journaling exercise for Module 1. In this journal prompt, it asks to reflect on the type of volunteer role you would like to pursue within hospice care. Think about what aspects of direct patient care, such as maybe companionship, art therapy, whatever that looks like, or if it's indirect care, is it administrative support, fundraising, community outreach? What is it that appeals to you the most and why? How do you believe your strengths and interests align with these roles, and how do you think you can make the most meaningful impact on the lives of patients and their families? This is a personal journaling thing. It's not anything that you need to share with anyone else, but take some time and think on that. So please pause the video, reflect on this question, and when you are ready, we will continue together. Okay, as we get ready to close, we're going to take a moment to watch one last brief video that highlights the importance of you, the hospice volunteer. This is another My Hospice story. It's by Mr. Greg. And again, it's just a little kind of testimony review of the impact that hospice has had on a family. To access this video, please use the link provided in your Module 1 handout. All right, well, you have reached the end of Module 1. Congratulations. We do ask that at this time you complete the Module 1 quiz. To access this quiz, please use the link found in your Module 1 handout. It is not a scored quiz or anything like that. It will provide you with the answers once it is completed. It's just a way to review and recap some of the information that we covered today in Module 1.